With us. Now, April 7th, which was yesterday, was World Health Day. And this year, the focus was health for all. And yesterday marked the 75th anniversary of the World Health Organization, WHO. World Health Day is a global health awareness day under the auspices of the WHO and other related organizations. The 7th of April marks the anniversary of the founding of that agency in 1948. Now, let's bring it home. Nigeria's progress towards this goal of giving health to all has unfolded at a rather slow pace. And the country's health financing landscape is characterized by suboptimal and grossly inefficient public spending on health and high out-of-pocket expenditure for citizens, as households currently cover the cost of 77.5% of the country's total health care spending. That doesn't sound too good.
Doesn't sound good at all, despite all the efforts being made over the years.
And although there is now health insurance, I don't know how many people are actually availing themselves of these companies who offer health insurance policies.
How many are aware?
How many are aware, and how many can afford?
And how many can afford?
Well, these are issues we're going to take up with our guests this morning. Right now, I'm glad to welcome Professor Wale Tomori, who is a professor of virology. Remember, Professor, from the COVID days? Good morning, Prof.
Good morning. How are you?
Good to see you again.
My pleasure, too.
Yes. So, World Health Day. It's like Nigeria is not part of this world we're talking about. Because how well can you say that Nigeria is walking towards giving health to all?
Thank you. Let me just start by saying that the World Health Organization in the 75 years has done well. Smallpox is out, polio is almost gone. Without the World Health, I'm sure the world would have been worse than it is. Unfortunately, we cannot translate that to our country. When we say the world has done well, it is a big range. Some have scored 0, some have scored 100, and then on the average, you said the world has done well. But there are some, like our country, that have been at the bottom rung of the health parameter. We have not done well. I was listening to what we're saying. Indeed, not just in the area you're talking about, in many, many areas, we have not really done well. We could have done much better. We have the resources to do it. If you remember, Nigeria was the place where in 2001 they said 15% of funds should be put to health. Nigeria has been one of the countries that have never even near half of that. So we have not done well. Let's be frank with ourselves.
Well, that's a little disturbing. But is that for reason of no activity, for reason of a dearth of ideas? What is missing, Prof?
I think, first of all, one needs to take it back a little bit. I mean, my generation, I used to say we survived by chance. The current generation, they have a choice because there have been some improvement. I mean, let me not be that pessimistic about our country. My generation, my father, we were having children because they're not sure who was going to survive. Nowadays, you can almost be sure that, if you have 2 children, you give them the proper vaccination, you take care of them, they will live. I mean, so that's why I said we survive by chance, and they have a choice to survive. And I think that has improved. I mean, even in my secondary school days, when we had free health education, free health up to the age of 18, apart from free education, which we had. So Nigeria has made steps, but it's like, I think our population, there are certain things we not do. We're not put enough into health. to meet the way our population was growing. You may be building the hospitals, maybe setting up all those other things, but then it has to be matched by your meeting. You use the word health for all. And if your population outstrips the resources you are providing, then you're not achieving the health for all. Whether it is a matter of ideas, I don't think so. We have policies, fantastic policies in the country. I think it's the implementation that has certainly been a major problem with us in Nigeria. And the implementation comes from the fact that we don't implement completely. We don't follow all the guidelines. If there are 5 steps to take, Nigeria will go to the 5th one and forget numbers 1 to 4. And all of this is based on where self-interest overrides your national interest. A lot of the problems we are having is the implementation by the people. The people who are responsible for implementation are responsible. And if they do it well, then of course we won't have the problem I'm talking about. I'll give a few examples. You look at the policy and it says take step 1, step 2, step 3, step 4. Step 5 is where Nigeria will go to because that's where the money is. The first steps, they don't gain too much from it, and they jump to step 5, forgetting that you can't do step 5 without doing 1, 2, 3, 4. And this is what has been the thing that has been affecting our policies in Nigeria.
Prof, we had a medical practitioner here who told us some time ago that Nigeria was actually a destination for medical tourism in those days. The days of UCH especially. Even Caucasians used to come to UCH to have their babies. And we thought, wow.
Wait a minute.
Wow.
Did that really happen?
In this country? Is somebody telling us porkies? But
no.
We know that that was what was happening. So is it just the issue of the population that got us to where we are now? The explosion of the population?
You know, I made two points. The fact that self-interest overriding national interest. In the days when we were growing up, we had a government that had what we call good governance. And that's what made people like me even go to school. I was talking about, we talk of family tree. In my family, we talk of family forest. I mean, where there's so many of us, there was no opportunity to go to school or anything. But then we had good governance that brought good governance, from free education, free health, and all that. That has not been continued. We've not had, let me say, since 1966, when we had our first school, this country has been going backwards. No continuity of good governance. And that's what has led us to where we are. In the absence of good governance, accountability, and transparency in what you're doing, the money that goes into health, into anything, education, or gets in the pocket of the wrong people, not the pocket of the people, not for the improve the life of the people. So in a combination of with our population, which is quite out of control, we've also have people who have not taken that spirit of serving the people into their activities. They tended to serve themselves rather than the people. So the combination of that, population, poor governance, has led us to where we are today.
Well, Prof, I know that, sometimes you literally have to stifle yourself from your patriotic fervor, and you struggle to stay within the health space where you are, because I've listened to you talk with passion about Nigeria, and your patriotic heart is undeniable. But if there is anything to cheer, Prof, what is it? I'm not talking about the technology that have improved over the years, because you spoke to the fact that back then you lived by chance, but today you seem to live by choice. That's for children. Is there anything to cheer in our 60-something years as a nation, especially in terms of health? I've been hearing of health for all since the 90s, and what was it even since the 80s? Health for all by the year 2000, housing for all by the year 2000. I heard that
Mercedes
so many times.
for all by the year 2000.
All kinds of things, all kinds of promises were made. But now we're still talking about health for all. And an abysmal percentage of people are still struggling with health insurance. We'll come to that. But is there anything to cheer, really? Have we made any progress at all even with all of the gloom that we've listed, is there anything to cheer in our health space?
Yes, there's always something to cheer. We are alive. That's the first thing to talk about. In spite of all the problems, some of us still survive. But then in the desert of non-performance, we can also look at the fact that smallpox was eradicated, and Nigeria was part of it. And I remember many of my people in my colleague who died of smallpox, who became blind. I even have in my family people who were blinded by smallpox. But we don't see that today. I grew up in my primary secondary school with people who were lame and crippled and were walking over. Polio is almost gone, at least in the world. It's gone in Nigeria, although I see having a few cases here and there. But generally in Africa, polio is gone. So you can count on those two places. Many of the epidemics that used to ravage us, vaccines have been introduced. Yellow fever, for example, we're still having it. The fact that we're not succeeding with, say, yellow fever and vaccine production, those other issues, is because we are not, putting all our resources into what it should be. You mentioned immunization coverage for Nigeria, for example. We shouldn't be where we are. Nigeria should not be having diphtheria now, if we had done our immunization properly. So the tools are there. Using them for the good of the people has always been a major problem. But like I said, you can talk of smallpox is gone. Polio is almost gone. I feel a bit sad that a few other things which we should have spent our money on. Lassa has been a major problem since 1969. Some of those things that affect us directly, we seem to be waiting for external people to come and solve the problem for us. And I think that is wrong. It's our problem. We should be focusing on those ones with the resources that we have. And is it that we don't have resources? We have resources. We have resources. We're just misusing our resources, and that's the problem.
And Prof, during COVID, I must bring this in many of our engagements with yourself as well as other medical practitioners, it was brought to the fore that we had to pay attention to the health sector because COVID came and it didn't matter whether you were rich or poor. You just couldn't move. Even if you were ill and you could afford to go abroad, you just couldn't go because the whole world shut down. So since COVID, Prof, have you seen any determined or concerted effort to improve on our health sector?
Yeah, well, when COVID came, you saw what we saw. There were a lot of government efforts, funding. Some huge amount of money was supposed to be put into COVID and solve the problem of COVID. But again, it was a knee-jerk reaction. Everybody was, the economy was going down, so we had to do something. But is it permanent? Is what we have put in place? Is it what we can? Is it something that is durable? I said no, and that's because the problem is a lot of our leaders look for opportunities like this. Sorry to use the word, to make money, and that's where they make what I call blood money on the life of the people. And I think this is the thing. If we had a consistent policy that we follow all the time, not dependent on foreign agencies, but focusing on the needs, sometimes it doesn't take that much, when you look at the percentage we're talking about of what we need for health. It doesn't take that much. But even the little much that we put, we misuse it again. So are we ready for the next epidemic? Maybe that's the question you probably will ask me. I'll say no, we are not. Because, we were dismantling all of those facilities we set up during COVID.
Well, Prof, let's decrypt this. The short changes that we have, if I can use the term.
Yeah.
Generically, we've said government, we, and all of that. Now, there are 3 tiers of health, the best we know. And there's what you medical practitioners will call primary health care, secondary health care, tertiary health care. And at the end of each of these, there are levels of authority. And there are human beings officers or medical officers assigned at the various levels. Where at would you say we have the greatest lack?
Let me again to bring the point clearly. There are certain states that have done very well, I mean, with COVID, and they have some enduring things in place. Lagos State, where you are, for example, is one good example. You've put in a lot of things, and you can see it's because of persistent policies over the years. It's not just something because of COVID. You remember when Ebola came? I mean, they came from that, and they move on to what they are today. So you can see that consistency with one or two of the states. I think you raised the point. I mean, look at our constitution. It says health is, what's the word they use? They use one word for health, that is something for both the state.
On the concurrent list.
Concurrently, sorry, that's the word. So there is a concurrent list, which means everybody has a role to play. But the states have abandoned their duties. Of course, there's no local government because the states also have overtaken the local governments on what we're seeing. So everything is in the hand of the federal government. And the federal government can't do all of those things. In the time when we started research in Nigeria, states were taking care of their own problem. I remember in Ibadan, when we were there, when we started, we were getting reports from states, not from federal. We were the ones who were informing the federal that this state has a problem, they need help. Because they knew where to go, and they put money into it. But suddenly, everybody is now going to Abuja for everything, and therefore the states have abandoned their duty. The state have emasculated the local government, and so this is where the problem. We used to go to local government areas in those days, and go straight to the local government. Just solve the problem that they are there. You remember when we had the smallpox? I think not smallpox, monkeypox. When monkeypox came out of Nigeria. Into US. It was a local government that detected it. The only time they called their federal was when it involved international travel. And that's when, because the local government couldn't do international travel. But all of the problems concerning with monkeypox or detection and everything was done at the local government level. And that's what we should have done. And that's what Professor Olukoya Ransom-Kuti came up with his big policies. So that at that level, because that's where the problems occur. At that level, we should equip them to be able to solve the problem. What we have right now is our federal running helter-skelter all over the country, like you used to say, like decapitated chicken, in all directions. And that's what we do. Because states have abandoned their duty. Federal government has to take over that one. I think we need to go back to that level where states and local government would take care of the situation in their domain.
But isn't that a little disturbing? No, seriously disturbing, Prof, because I mean, okay, so there is that dictum of the SDGs, there's a health goal, for the SDGs. And I also understand, I mean, that's partly the reason for this whole talk about what Alero mentioned the other time, which is to cut down out-of-pocket spending for health as much as possible. You spoke about Ibadan, the other time, and there is information out there that, Oyo State, in Oyo State, for instance, that you have that with 8,000 naira, you have unfettered access to all basic, health treatment across board. In fact, we also understand that there is a special arrangement for pensioners and elderly people. That is in Oyo State. I mean, maybe that's just one of such examples as the one that you also cited in Lagos. But that is what we have now. However, you also mentioned the role that the federal government is playing here, in the various states as well. Is there a place of disconnect between the, health authorities at the federal level and at the state level? Where should there be that connect where at the end of the day, it's about people, not just about whether or not it is one official at the federal or one official at the state level?
I think we go back to what we're saying. States have a role and a duty. Let each chair of government carry out its role and its duty. And once we get that one, of course, then we're working together as a country. There's none of them can work in isolation. All the good things you're talking about, Lagos, I'm talking about Oyo State, it ends there. I mean, it doesn't affect the people in maybe the next state. Until we all work together along that line collectively, state doing its own job, local government doing its own job, then federal is being in a position to oversee and coordinate activities. But right now, the federal is the one doing all of the things in most of the states. Many of the a few states which we mentioned, if many of them are not, they're not doing what they should do. I went to a state during one of the epidemics. I can't remember the state now, and the commissioner was actually asking me to beg his governor so that they can get a vehicle for their Department of Appeal Division so that they can carry out activities. And I said, but he appointed you. Why should I be the one begging? I mean, these are some of the ridiculous things that we find in our distance. You know, we have almighty governors who do what they like, you know, who don't probably know why they are elected in the first place. And these are some of the issues we are getting. So leadership is important. And when they give that type of leadership, people will follow. People will follow. Nigeria is a group of, we follow things that they're listening. And if you give the right direction, our people will follow. But then we've not gotten the right direction for a long time. And I use the word, there was good governance when I was growing up. Now, we never had good governance in this country. Name it from every government, from the military era in 1966 up to today. We don't have anything called good governance. We're only hoping for future that, I don't know what the future will bring.
Prof, what are your thoughts about this Japa syndrome of medical personnel out of Nigeria?
Yeah, I mean, they continue to Japa, when you don't create the enabling environment for them to stay. You talk about training. I mean, I'm using some stupid, sorry to use the word, bills that are coming out that say you must stay in your country for 5 years before you can go and get your license or something of that nature. We talk about capacity building. We don't talk about capacity retention. You need to create an enabling environment for that capacity you have built to function. If you train me as a doctor and the facilities are not there, you want me to spend 5 years doing nothing? These are some of the things. So we must create that enabling environment for people to stay. My generation stayed because I had something to work with. You think I would have stayed in Nigeria if the country, I mean, you mentioned the time when people used to come to UCH from outside the country. If the situation was not like that in the virus lab where I was working, I mentioned to you I used to go to local government and do those. If that situation was not there, you think I would have stayed? I wouldn't. So I don't blame all those who are leaving. It is not patriotism or lack of patriotism. You create that a brain will drain to where it can be nurtured. And that's what is happening to us. All these things we're talking about, diaspora are coming to set up things in Nigeria. Forget it until we resolve the basic problem. Create an enabling environment for the people to function. The diaspora people will come back. At the time, Nigeria was diaspora for India, wasn't it? The Indians, they were the ones teaching us in many of our secondary schools. The Indians that are coming back today are the ones heading Dangote company. They're not coming back to teach because they have facilities in their countries. So their country government decided to create the enabling environment for their trained personnel to stay. That's the solution. It's not making draconian laws that say you must stay for 5 years before you do. Doing what? Doing what?
That's very interesting. So you don't see any life in that law?
They have not addressed the basic thing. You don't, I mean, like I mentioned to you, I said Nigeria will have 1, 2, 3, 4, 5 steps. We jump to the 5th one and don't do 1, 2, 3, 4. That's what is happening again. Before you give that law to say stay for 5 years, you must create the environment for the person to work. If he doesn't have a place to go, no electricity, no hospital, no what is he doing in the 5 years that he's going to stay?
Yeah.
So you solve that problem first before you make those stupid laws. Sorry to use the word.
Well, interestingly, some doctors have been reacting. One of my colleagues, my friends, I was telling Alera earlier in the day when this program began, was saying, look, if that law goes through, no problem. But let there also be a follow-up law. All government officials, federal, state, or local, must remain in Nigeria and use those the doctors that have been mandated to stay before.
That's fair enough.
What do you think of that?
It's fair enough. I mean, you can't make law for one group and leave the others, and then say the others can do what they like. No, it's not. So let the law go for all of us in every aspect. Then we can come and suffer all the things together. You can't pick out just one group and say you must stay. There are other people who are leaving the country. Engineers are leaving, nurses are leaving, people are leaving. It's not just those. How many of the young people are going out of this country? How many of them? IT experts. If you don't create that enabling environment generally, people will not stay. I think that's what I'm saying. Let us look back on what the question that you should be asking, why are people leaving? A lot of people say, oh, it's because of they are not patriotic. That's bullshit. Sorry to use the word. They are leaving because they cannot fulfill their professional sense that they go to. You train me as a doctor, I can't work as a doctor. There's no professional fulfillment. That's the major thing that is making people living. Of course, there's also the aspect of life. So my parents will spend all this money training me, and then for the next 20 years, I'm still living with my parents, who have spent all his resources in his retirement, he's still feeding me. What type of nonsense is that? These are the things we should be looking at. We should address those issues. Remember when people used to go across the Sahara Desert to go into Europe and then go and drown in the Mediterranean Sea? And people say, oh, why are they going there to go and suffer? If the situation was good at home, would they go? And instead of our leaders addressing those things, they are blaming those people. What have you done to keep your people?
Well, Prof, just maybe one or two other issues very quickly. Talking about health for all. Is the issue of health insurance. I mean, it's something that's been on since the early 2000s, you know, and all talking around the fact that, look, we need for people to cut down on out-of-pocket spending, embrace this health insurance scheme of the federal government, state government, and all of that. A number of companies have done it, and from what statistics Lera gave earlier, the number of people who are on the program are nothing to write home about. So one wonders what is missing in the whole conversation around getting people involved in these health insurance programs all across the country, so that at least we can have some health for all, or health for more people than what we have now. What do you think is missing? What's the gap?
I think there are many factors. First of all, the implementation of it. And first of all, if you give me the insurance and say, okay, you can go to the hospital. The question, we have been talking right now about the poor health situations, facilities around. So I get an insurance, I go into the hospital. I get there, I wait for 24 or 5 hours to get service. And at the end of it all, I'll probably better off going to go and pay for something I can get a better service for. So we need, again, back to, you don't keep insurance when the health system itself is not in good shape. You know, that's one of the points. So yes, there's health insurance. And then if you notice, most of the people that are getting the percentage you're talking about, they are mainly civil servants who are forced by government rule to enroll in that. I mean, take the civil servants out, you probably will have 0.00% of Nigerians on health insurance. But again, I think one of the major problems is the fact that what service that you provide with that health insurance? What facilities are there for people to go? I would rather make sure, you know, if I have my little money, go to a doctor and get it done on my own rather than line up with the health insurance with the poor service that we're getting. And then that awareness. So we need to, again, back to what I was saying, you need to create an enabling environment for things to function.
Do you think there's enough awareness of these health insurance schemes all over the country?
No, I mean, there's not enough awareness of anything in the country because government doesn't, really, let's be frank with ourselves. What awareness are we getting? We only talk about it when there's something. Again, I'll go back. Should we be talking about Lassa fever in Nigeria that is like is a Christmas disease? It's not. It's been with us since 1969. What kind of awareness have we created for our people?
Add to that, Prof. Just a quick one because we're running out of time already.
Okay.
Add to that the trust quotient, because on the one hand is awareness, as Lera have mentioned. On the other hand is whether or not people can even trust government institutions such as general hospitals or whatever, you know, health facility that belongs to government. Do you see that as an issue as well?
Yeah, because I alluded to that. That what service are you providing with insurance? When I can go into there and wait for 4 hours before I can see a doctor. or something. It's all part of the whole story. Yes, awareness, the facilities are not up to par. And then these are some of the issues that we need to be talking about. Nigeria should not be anyway, it's our country. But we'll keep seeing what we can do to get it better.
It is our country, Prof. Professor Wale Tomori, Professor of Virology, thank you very much for joining us on this occasion of World Health Day 2023.
Thank you, my friend.
Happy
Easter to all of you.
Happy Easter to you too. And thank you for staying with us at home. We'll be right back shortly with another interesting conversation.